You talk about some of the first steps you take in terms of treatment?
Well, the first thing you do is you want to look at this laxity business and see if it is about the same on both sides. You always want to check out that problem. Now, occasionally you will actually see swimmers who have painful shoulders who have the opposite. They actually have a stiff or a tight shoulder, very similar to what you see in tennis players or baseball players, but it's fairly rare. But if it is a little tight, then obviously you want to loosen it up with stretching exercises. If it's too loose, you can't tighten it up with any exercises. You just have to deal with it. But the problem there is that so many swimmers do so much stretching. It's because you think, well, boy, if a little bit of stretching is good, then a whole lot of stretching is going to be better. And these lax patients, you don't need to stretch them anymore. They're loose enough. That's not their problem. That's not why they can't swim. They don't need any more looseness. So you want to make sure that those patients are not making it worse by trying to stretch beyond the point that they need to be stretched. So a good evaluation of flexibility is very important. And a good evaluation of the rotator cuff strength, and there are ways of checking for rotator cuff strength. Are very important. You need to look at all of the three components of the rotator cuff to make sure that they are balanced, that they have some strength. And you need to make sure that when you test it this way, that you stabilize the shoulder blade by actually having the swimmer pull their shoulder blade back and like they're trying to pinch the shoulders together in a position we call retraction, because that will then give you the best understanding of rotator cuff strength. If you measure their rotator cuff strength in the classical slope-shouldered, stoop-shoulder position that most swimmers have, then you will underestimate the rotator cuff strength and start doing exercises for rotator cuff when indeed the problem is the shoulder blade itself. So you want to stabilize the shoulder in a retracted position and then measure strength. You want to look at this laxity, what's called the sulcus sign, and then you'll do specific tests for instability. You'll do look for anterior instability. You look for the injury to what's called the labrum. You'll do this. There's a whole series of tests to look at the stability issue. You will do your impingement test to see whether or not the bone is rubbing. A lot of these tests, if you stabilize the shoulder blade, will show a difference. So you may have an impingement test as you try to do the freestyle motion where you try to bring your arm over the top of the shoulder. If you pull the shoulder blade back, you find it doesn't hurt as bad. So that tells you once again that the shoulder blade is playing a major role in this. The most important thing, or one of the most important things, is to look at the core, at the trunk. Because that's where all your force is being generated. And so we actually do what's called a one-leg stability series, where we have you stand on one leg, and you just look and see how they stand. Can they stand on one leg? Do they tilt their pelvis? Do they have to use their arms to balance themselves out? Because that indicates that the hips and the trunk are weak. Then we have them do what's called a one-leg squat, where you have them just squat down about 45 degrees at their knee, bend about 45 degrees knee, and then come back up, and you watch and see whether or not they can do this once again in a smooth direction. Can they hold their balance right there? The reason for that is that all the muscles that you're trying to use for your arm, to move your arm, the big latissimus and the pectoralis and all these other muscles, attach through the core. If your core is weak, then that's important. The other thing is if you don't have a good core, you can't rotate when you're trying to get out, when you're trying to recover, when you're trying to get out of the water and get your head above water, but mainly get your arm above water and then roll back. If you don't have a lot of good core strength, you can't roll well. So there's a lot of reasons to look at the core as part of the problem. In a very large percentage of the patients, I'd say probably 80%, you have what I call a victim, which is the rotator cuff or the shoulder or something like that, and then you have like the shoulder blade or the core or the hips or something like that. So there's a lot of these factors you have to look into because swimming is such a complex activity. You need to look all the way up and down what we call the kinetic chain to make sure that all the other parts are working well too.
So it sounds like a comprehensive exam is really critical to identify all the specific points that you want your therapist to address when they're treating this condition.
Very definitely, and I've seen it very common where they'll have One of the classical ones was a really good swimmer here in town who also liked to play soccer, and they'd had a hurt knee in soccer season and went out and started swimming, and that sore knee had actually caused their hips to be a little weak, and they started developing shoulder pain. So we had to fix their knee before we could fix their shoulder right. So it's you need a pretty detailed, you need to look at this pretty carefully.
Can you talk a little bit more specifically about how you structure your therapy programs when you send these patients to physical therapy?
Yes. First of all, we have what we call the local exam, which is the shoulder exam, and then we have the kinetic chain exam, and you have to go through all those parts, and therefore then you have a kind of a protocol where we start with the core and then we work out, because a lot of times they'll be sore, they'll have symptoms, of impingement or tendonitis in the shoulder. So while we are addressing this in terms of rest, relative rest, or medications, or whatever we're doing, we're also working on the core. So we always start with a core stability exercise program where we do a lot of lunges, a lot of core exercises, a lot of the dry land training, a lot of good machines that you can use to develop your core. Those balance balls are just excellent core exercises. So there's a lot of ways we do the core exercises. We work on the shoulder blade. We have a series of exercises called the scapular stability series, and they have these names. They're called the low row and the lawnmower and the robbery and the fencing. They're all different positions, but basically what you do is you want to pull your arm like you're doing a rowing motion, in a row on your exercise machine, where you pull backwards so that you're trying to get your what we call elbow in your back pocket. You always want to end up with your elbow in your back pocket so that you get retraction of the shoulder blade and pulling the trunk back this way. And we do most of those, once again, standing, so we get the core involved in these exercises. And then we will after we get the core stabilized and the scapula stabilized, then we start working specifically on the shoulder itself, whether it be some rotator cuff exercises. And once again, we want to make sure that the rotator cuff is working as what we call a co-contraction or a compressor cuff, so it's pulling the ball into the socket. So we'll do a lot of what we call punches. We'll do a whole lot of coordinated activities. We don't do a whole lot of rubber tubing exercises except in the overhead position. We don't have them do the rubber tubing exercises down at their side because you don't swim with your arm down at your side. So we want them overhead doing rotator cuff exercises in the overhead position. So it's a progression we go through. We also use, if we need to, modalities such as ultrasound if you have an acute soreness. Biceps, very interesting. If you have biceps tendonitis, once again, ultrasound is very effective at getting rid of some of the symptoms, but the biceps is most effective off of a stabilized scapula. So you get your shoulder blade back, and it works a lot better. And then we will work on the bicep strengthening from there. And then you really need to have a good relationship with the coach, because the mechanics are so important. Do they really roll well? Do they really get their arm out of the body? Do they hit the water with their arm when they're grabbing exactly the right position? Do they turn their hand exactly right? Do they pull through? There's all these mechanics things that you have to do. Do they kick well? That have to go along with a good rehabilitation program, because otherwise, if you have bad mechanics and you fix their injury, then they're going to come back to see you because they still have bad mechanics. Likewise, if you try to fix the mechanics, but they have a weakness or an injury, then if you fix the mechanics, they're going to come back and see you. So it's a hand in glove. You have to work both sides of the equation here, the physical component, the injury component, and the mechanics, the swimming component.
I think your explanation really emphasizes that the approach to physical therapy, because if a doctor happened to see a swimmer and said, oh, you have a rotator cuff tendonitis, and you just send them to physical therapy saying, oh, just do some exercises for rotator cuff tendonitis, you completely miss some of these other critical components, and you might have a real problem getting that swimmer back into the pool to compete.
That's unfortunately correct.
Their shoulder blade or their core stability.
Exactly right. You'll see somebody that has quote unquote impingement, and they'll say, okay, we'll put a little cortisone in there and relieve some of the impingement, and you demonstrate that you have some rotator cuff weakness, so we'll start you on some of those open chain, those rubber tubing exercises for the rotator cuff. And so the swimmer does it, and all they do is hurt. And they say, well, that doctor's a quack. He doesn't know anything was going on. Therapist didn't work because all he did was make me hurt worse, so I don't believe anything. So I'll just, I'll try to work through it. When in fact, that's what we call the PACE sign named after Bevan Pace, who was one of our therapists. If these rotator cuff exercises hurt, that means you're starting the rehabilitation at the wrong place in the kinetic chain. You need to back, down the line until you come to the base of where you can go. And so, really and truly, I mean, if swimming is a very difficult sport because of all the factors we mentioned, and so it really takes a lot of fine tuning, and it doesn't take much to get off because of so many things going. But you can tune this up, but you have to start all the way from the base and work out, because you never can catch up if you try to work on your shoulder if your core is still bad.